This year has been a particularly potent year for hay fever. We've not had a lot of sunshine in the lower half of New Zealand, but boy, have we had seeds and pollen. It's hard having hay fever when you've got work to do, and the workplace is way more sensitive to someone turning up with watery eyes, sneezing and coughing. Hay fever also isn't something that's just done in 7 to 10 days like a cold. It can last for months. So today we're talking about what you can do when hay fever strikes. Let's get started, shall we?
Well, hello, all you beautiful people, and welcome to Project Joyful, the podcast for health-centered leaders. I'm your host, Tracy Tutty, your medical herbalist, neuro-identity evolution practitioner, and high-performance coach. So hey, Project Joyful isn't just about being happy. It's about consciously creating a life you love. It's about remembering how to reconnect with your soul-centered joy. You know, that joy that comes from doing what you love, from living on purpose, and from being in a life that allows you to experience deep joy, moment by moment. It's also about bringing that joy into your workplace and using your skills as a health-centered leader to heal your team. So let's get started, shall we?
There is nothing worse than trying to be productive at work or get things done in the home when you're full of hay fever. And despite the name, hay fever isn't necessarily something that only comes on in the height of summer when the hay bales are traditionally in the field. Hay fever can affect you at any time of the year. And whilst it's hard enough leading your team when you're full of hay fever symptoms, the added sensitivity to coughs, runny eyes and sneezes makes it even more stressful, especially if you're commuting on public transport. Hay fever season is most likely to turn up in early spring when there's lots of tree pollen about. You can also get it in late spring and summer when there's a bunch of grass and weed pollen, or in the autumn or fall when that ragweed pollen is most prevalent. The most common triggers are pollen from trees, grasses and weeds, dust mites, pet dander, and mold and fungi. So what exactly is hay fever? Well, it's also called allergic rhinitis, and it occurs when an airborne allergen makes contact with the moist lining in your nose and your sinuses. Your immune system rises to the challenge and it responds to this invasion by producing immunoglobulin E, IgE antibodies. And these antibodies are designed to protect you against this allergen. And from this point, whenever you come into contact with that particular substance, your IgE antibodies signal to your immune system to release chemicals such as histamine. Now, it's the release of histamine that produces the symptoms of hay fever. So typical symptoms include fatigue, sneezing, a runny nose or nasal congestion, excess phlegm, and itchy red or watery eyes. And the excess phlegm can also run down the back of the throat, and this is known as postnasal drip. And postnasal drip can give you a cough, especially at night, and it can give you a sore throat or you feel like there's a lump in your throat. You try to clear it by swallowing frequently, but to no avail. And it can also cause bad breath, hoarseness, and you also might have an urge to clear your throat a lot. When dealing with hay fever, we're looking at two particular instances of it. The acute onset, which is where all the symptoms are going full bore. And this is short term and it feels really intense. Chronic hay fever or perennial allergic rhinitis is when you've got hay fever for long periods of time or you've got it throughout the year. And chronic hay fever is often an allergic reaction to something that's in your environment, such as dust mites, mold or some fungi or animal dander. Chronic hay fever can also be caused by an intolerance to histamine, and this histamine intolerance can occur via two mechanisms. You either have more available histamine, for example when there's a prolonged or frequent contact with an allergen, or your body's just not as effective as it could be at breaking down the histamine that's released as part of your immune response to an allergen. And your ability to break down histamine can be affected by your inherent enzyme function or a lack of cofactors, some medications, alcohol, or also some gastrointestinal disturbance. If you've had hay fever for a long time, it's good to check that you're eating or supplementing with the cofactors that your body needs to break down histamine. Vitamin C is a cofactor that's needed for diamine oxidase or DAO enzyme function. And you also need B6 and copper. Now, DAO is a digestive enzyme that breaks down excess histamine in your body. And vitamin C can help break down histamine, and it also acts as an antihistamine. Now, studies suggest an optimal dose of 750 milligrams per day for that antihistamine effect. And some studies report a dose as high as 2,000 milligrams when you've got acute allergic rhinitis. Now, the thing to remember with vitamin C is that high doses of vitamin C can loosen the bowels. So begin with a gradual increase in vitamin C supplementation to that 750 milligrams a day, and then test each increase, reducing the dose if you notice an increased laxative effect, because that means you've hit your body's personal threshold. Now, not everybody experiences loose stools with higher doses of vitamin C, but you don't want to be at work only to discover that you're one of the few. The right combination of probiotics can also be helpful, as the research shows that some bacterial strains can reduce hay fever symptoms by inhibiting mast cell degranulation and the production of interleukin-10 or IL-10. Now, mast cells do a bunch of stuff, but in relation to allergies, they notice something unhelpful in your body, like a parasite or a bacteria, and they alert your immune system. And they also release chemicals like histamine, heparin, and cytokines. And when they detect these harmful substances, they release those. Now, IL-10, that interleukin-10, is a cytokine, and it dampens down the immune response to allergens, and it's also anti-inflammatory. One of my favorite probiotic supplements, which I use in clinic, contains Bifidobacterium bifidum, Bifidobacterium lactis, Lactobacillus acidophilus, Lactobacillus casei, Lactobacillus salivarius, Lactococcus lactis. Now, that's quite a mouthful, I know. It's also got riboflavin and biotin in it, but those particular strains of probiotic or bacteria are very effective and supported by research. Now, there are other things you can do in terms of your diet. So if you can tolerate it, consider bringing in more of the allium family. So this is your garlic, your onions, your leeks, your chives, your scallions. Also bring in turmeric, green tea, broccoli sprouts, rosemary, or any cruciferous vegetable. They're all beneficial, because these foods dampen down the release of histamine. They reduce inflammation and they reduce oxidative stress. And these are all things that can help with allergic reactions. Now, some people find it helpful to reduce their consumption of foods that are naturally high in histamine. And to see if this is helpful for you, what I'd suggest you do is you just cut out one food for a minimum of 4 weeks. Bring it back into your diet without changing anything else, and notice how your body responds. So food and beverages that you want to consider for this include your aged or fermented foods and beverages like your wine, your beer, your matured cheese, your fermented foods like sauerkraut, kimchi, yogurt, kombucha. Although remember that these have many health-giving properties as well, which is why it's important to not do a blanket removal, but work out which one you have a sensitivity to. You also want to be taking out processed, cured or smoked meats like salami, smoked salmon or ham, and also anything that contains sulfites. And sometimes for some people also vinegar. Other foods to investigate include spinach, avocado, citrus, eggplant, cocoa or chocolate, tomatoes and MSG. Now, as you can see, it's a broad range of nutrients, right? So find those foods that are encouraging this response in you, rather than that blanket removal. Now, foods that encourage the release of histamine include the citrus family. So it's catch-22 with that one. Papaya, strawberries, pineapple, nuts, peanuts, tomatoes, spinach, fish, pork, egg, additives, licorice and spices. So as you can hear, it's quite a wide list, right? Which is why you want to investigate if any of these foods are specific to you. You see, personally, I'm not a fan of avoiding foods wholesale, as eating a wide variety of colourful fruits and vegetables ensures that you maximise the possibility of getting all the nutrients and cofactors that your body needs. But there might be certain foods that your body simply doesn't like, and it's helpful to know who those culprits are and to avoid them. There's also some medications that can interfere with your body's ability to break down histamine. So if you're suffering with hay fever and you're taking antibiotics, antidepressants, high blood pressure tablets, analgesics, or antiarrhythmics, check in with your doctor or pharmacist. So what natural remedies are available to support you during hay fever season? Well, a traditional herbal remedy is the use of a herbal ointment as a physical barrier. So the ointment traps airborne allergens, and that reduces the number of inhaled allergens. And to use it, you just apply the ointment around the edges of your nostrils. Now you can double it up by using an ointment which includes anti-allergic herbs such as nettle or longleaf plantain. And then in terms of your herbs, albizia is an anti-inflammatory herb that reduces histamine signaling. Its botanical name is Albizia julibrissin. Baikal skullcap is also anti-inflammatory and anti-allergic, and studies have demonstrated that it reduces histamine release by modulating imbalances in the Th1 and Th2 cytokines. Another herb to think about is Tenospora. Tenospora reduces histamine release by stabilizing mast cells, and it's also a fabulous immune system modulator. Now, other favorites of mine include elderflower because it's a wonderful decongestant as well. Longleaf plantain, which we've talked about, it supports the mucous membrane. And also bring in some nettle. Nettle is amazing. Research has reported that nettle can inhibit histamine receptors and reduce mast cell degranulation. So more than one reason for its traditional use as a springtime tonic. Now, if you're interested in learning more about herbs to support conditions like hay fever, I've got something that can help. I have an online course that will teach you the art of science of blending herbs to create tasty herbal teas. And it includes my done-for-you hay fever relief herbal tea recipe, which I know from my patients is really effective. I use it in clinic a lot. So discover the secrets that herbalists know when it comes to creating a tasty herbal tea. You want one that not only tastes good, but it's also good for you. So when you join the secret art of creating a tasty herbal tea, I'm going to give you a recipe book for it as well. Now, there's a link to it in the show notes. Now, remember, plant medicine is potent medicine. If you have any underlying health conditions, particularly if you're diabetic, you have high blood pressure, stomach ulcers, you're pregnant, trying to get pregnant, or you're lactating, or you're taking any medications, don't just rely on the information in this episode. Just because it's natural, it doesn't necessarily mean it's good for you. Please do get individualized advice by consulting with your medical herbalist. Not only are we trained in which herbs affect a particular health condition like hay fever or even what's going on in your current life season, we're also trained in herb-drug interactions and in choosing exactly the right herb for you. You see, your body knows exactly what it needs to heal itself, be that herbal, pharmaceutical, food-based, emotional, mind medicine. My job as your herbalist is to connect you with the herbs that your body is already searching for. And I'm going to show you how to do that in my online course. Now, as an executive coach and medical herbalist, I integrate health protocols, such as those that we've talked about in this episode, into my coaching sessions. And this ensures that my clients not only lead effectively, but they also maintain their well-being, which is so important. This holistic approach helps managers, executives, and professionals stay at their peak performance, even during the hay fever season. Curious about how I can help you? Message me on LinkedIn or Instagram. I would love to have a chat. Sending you lots of love. Bye for now.
Hey, thanks for listening to today's podcast. Can I ask you a favour? If our conversation spoke to you today, could you please take a moment to leave a 5-star review? Your review will help people discover this podcast, and together we can create a world where there's even more love and more laughter. And if you want to hear more from the Project Joyful podcast, just click the subscribe button. Bye for now.